My work has been also very, I think it kind of created that sort of positive feedback loop, knowing what I do can really make a difference. And seeing the difference in the people that I work with, whether that is the community, individuals, or even my patients, it kind of created that positive reinforcement that what I do actually has a meaning and has a purpose, which allowed me to stay in this kind of work that I am actually passionate about. Is something you'd said it like literally, it's just kind of feel like my calling in some ways.
You're listening to Further Together, the ORAU podcast. Join Michael Holtz and his guests for conversations about all things ORAU. They'll talk about ORAU's storied history, our impact on an ever-changing world, our innovative scientific and technical solutions for our customers, and our commitment to the communities where we do business. Welcome to Further Together, the ORAU podcast.
Welcome to Further Together, the ORAU podcast. As ever, it is me, your host, Michael Holtz, in the Communications and Marketing Department at ORAU. And listeners and viewers to the podcast know that I love talking about our Research and University Partnerships Office. And today I am talking to a former grantee of one of our RUPO grant programs, the Innovation Partnership Grant program. Dr. Youssef Roman is with me. He is Associate Professor of Pharmacy Practice and Science at the University of Arizona Coit College of Pharmacy. He is also a clinical pharmacy specialist at the Phoenix VA healthcare system. Dr. Roman, welcome to Further Together, the ORAU podcast. I'm so glad you're here.
Thank you, Michael. It's so good to be with you, and great job on pronouncing the name. It was well done.
Thank you so much. I get tripped up on all the letters and
yes.
the R's all lined up in a row. So, Youssef, tell me a little bit about who you are. I know I introduced you as an IPG grantee. You're at the University of Arizona, but I know when you received the grant, you were somewhere else.
Yes.
You were in a different state entirely.
Yeah.
So talk a little bit just about who you are to set the level for who I'm having a conversation with today.
Yeah. Thanks again, Michael, for having me. It's really a joy and a pleasure to be on your show and to be able to contribute and share a little bit about the work that I started in my previous position. Just to give you a background about myself, I'm a clinical translational scientist by training, but I'm also a pharmacist by my profession. In terms of research and interest, I'm always very interested in working with my marginalized population and underserved population and working with these kind of groups. I think it kind of allowed me to feel that my work has a purpose and also can make a difference. It's not just about publication and grants, but also knowing that you're making a dent in real issues, whether that is access to care, participation in clinical research, understanding the disease better so we can communicate better with the patient and others. So this is kind of what I do, is really working with marginalized population, engaging them in research, working around the barriers around access to care so we can achieve equity across all sectors of the community.
And this is a huge issue. I think you're talking about marginalized communities and underserved communities. We just literally, as we're having this conversation a week ago, held a rural health research innovation cluster workshop that I know you were trying to get to and were unable to. But really the focus being on serving these underserved, underrepresented populations in rural communities where it is hard to really have equity for access to care, access to pharmacy services, even access to mental health, access to women's health services, all of those things. How did you get to the point that this was work that you wanted to do, that these were communities you wanted to help?
Yeah, no, that's a great question. And I thank you for asking that one, because I do feel that if we reflect on our own journey and who we are and what inspires us and, our own upbringing and all those things, I feel sometimes you kind of have to align who you are, who you want to be, and how you want to build your legacy as an individual by the things that you do on a daily basis and the things that you want to do on a short term and long term. And so reflecting on my own journey as I'm an immigrant and obviously somebody who came from very underserved community who had limited access to resources and kind of struggled to find ways to achieve, our goals in life, whether that is thriving in education, having opportunities, all of that. So I think reflecting on my own journey as an individual allowed me to appreciate and feel connected with people who are further away from this big, glamorous, big hubs and big institutions, and when you can do everything and everything is under your fingertip. And so this is kind of how I started my journey in this work about marginalized community and underserved populations. I also feel like my work has been also very, I think it kind of created that sort of positive feedback loop, knowing what I do can really make a difference. And seeing the difference in the people that I work with, whether that is the community, individuals, or even my patients, it kind of created that positive reinforcement that what I do actually has a meaning and has a purpose, which allowed me to stay in this kind of work that I am actually passionate about. Is something considered like literally, it's just kind of feel like my calling in some ways.
Mm-hmm.
Yeah.
I love that. I feel that about, I'm a cancer advocate in my life outside of work. I'm a cancer survivor. And
amazing.
So that the work that I do in advocacy, I can see makes a difference. And I feel, as you said, you feel called to this work. I feel called to do that work. You were the recipient of an ORAU Innovation Partnership Grant, which I know you used to do some of the work that you're doing. Talk about that grant and really how you put those dollars to work.
Yeah, that's a very important question. And again, it really makes me just to appreciate what ORAU does for help innovating this kind of work. So obviously, I when I was at the Idaho State University, I was really interested in how can I engage people to be able to do research, and how can we make research as a vehicle to form and drive policies. And that really kind of was the premise of this work. So it really, what we decided, obviously it was kind of my idea of kind of how I can do this. And so I kind of envisioned that plan, which is the CARE Coalition. This is community advocacy. And basically that's the CARE Coalition, what stands for, the Community Advocacy and Research Empowerment. And we're using that coalition to be able to build a team of stakeholders who are invested in engaging minority population, underserved population, rural population, which we know to be a big thing in Idaho, given the landscape of the state. And really, that was kind of the idea here, is that if we want to do research, if we want to change policies, we got to do them hand in hand. You can't just change policy without data, and you cannot advocate without having data to support. That's what we need to do, whether that is screening or increasing access or basically, asking or adding some sort of layers to care. All these things have to be driven by data. So it basically stands on its own, why we do what we do and why we want to do this and that. So really, the CARE Coalition was really the kind of the idea behind that, is that how can we generate research data that allows us to be able to advocate for policy and marginalized population and underserved population. So that was kind of the idea, the premise behind this coalition. And what we did was really, obviously it was kind of a big project, because I was very new to the state at that time, and I literally had no connection with anybody. It was really me forging a whole new path in a state that is very different, and it's new to me, and it's really like I'm learning as I go. But when you're passionate about something, and like I said, when you're called to do something, you will always find a way. And really, it started by literally making cold calls. Like I would just pick up the line phone and like talking to people like, hey, it's like almost like about like a speed dating. You talk to people, it's like, hey, this is me, and this is who I am, and this is what I'm hoping to do. Would you be interested in partnering with me on this kind of project? And I created like a verbiage that almost like a scripted messaging that I say the same thing to. I call people from the clinic, whether that is a federally funded clinic, underserved population clinic, specific community leaders, or names that were recommended to me. So really, this is how it started, literally by just being open and vulnerable and being not shy to call people and just introducing yourself. And we were able to build basically a core of stakeholders who are invested and obviously genuine about the work that we wanted to do, and being able to bring together ideas and representation from the various groups of the community so that we can build a vision of how we can move forward in terms of the map of this coalition, in terms of the projects that we want to work on, the priorities that we need to start working on. And that was really the whole idea, is to bring people together and basically brainstorm this idea that allows us to have like a roadmap for addressing these issues, whether that is health disparities, access to care, increasing faith and trust in science. All those things were definitely the end outcomes of this type of discussion.
That's amazing. And I know from, again, my advocacy work in the cancer space, representation matters. It's easier. I will never say it's easy to do research, but it is easier to get majority population folks involved in research than it is to get minority and underserved and marginalized populations in research. And some of it is because of what you said, trust in science and trust in research, and even feeling trusted to seek medical care in the first place. Just because of historical precedent around how people have been treated, some communities have been treated. So I love the idea behind this. How did the organizations you reach out to receive this, and then how have you all worked together to kind of advance your mission?
Yeah, no, I think it's a very valid point, and I think you bring really a big and very important element when you conduct community-based research, is how do you earn trust and how do you maintain trust? And also, how can you get people to be at the table where we talk about issues related to marginalized population, whether that is, again, the layers can definitely be many, and we can talk about it all day today. But for me, honestly, it came down to being genuine. I think that is something you just if that's something you're not genuine about, it's easy to tell. I mean, like I said, there's definitely unfortunate experiences where researchers went to the community, they got what they needed, and then just nobody knows anything about what happened to that data.
Right. Yep.
Absolutely. So that definitely, you learn from the past and forging into the future. And that was kind of my narrative, is that if I'm going to do something, it has to be really based on trust and basically transparency, and basically making sure that every member of the coalition or the community member, whoever is going to be involved in this, completely understands what we're doing. And there's no decision that's going to be made based on hierarchical, structure. Like everybody's involved, everybody's invested in this. Yes, I was the mastermind behind it, but anything will happen after that. It is basically a collaborative of people coming together to make that decision together. So togetherness was kind of really the key word there, is that can we bring everybody and collectively making a decision so everybody knows what we're doing, what the priorities are, what we're going to do first, what we're going to do last. And so that kind of how you earn trust, obviously in the formative stages, but definitely later on, it definitely can get more granular about the details of that. But that was at least the approach that I used when I just started to bring people together and build that, basically the core of that coalition so we can move forward.
Gotcha. And then how did you, as things have moved forward, what kinds of work has the coalition focused on? What kinds of things has the coalition done?
Yeah, so I think from the sort of the outcomes and really the grant just was really focused on absolutely not necessarily doing the actual research, but it was more of, can you bring the people together, the key individual, to form that core that allows you to have like a governance of individual that basically can oversee all the things that will come out of this coalition. And so this particular project or this coalition was really about creating governance, obviously internal governance, so that way we know what we're doing and how we're going to manage and how we're going to make decisions, how we're going to have a sort of like a voting process, all those things in place. So should we move forward, this is the approach that we're going to use. And that was really the purpose of this project, is to be able to bring the key individuals that will hold this position in this core that we basically we're going to operate and we're going to collectively use to make our plans and, map out for the future.
Okay.
Yeah.
And so now you're at the point where it's sort of like, we've got the structure, we've got the governance. Now let's talk about what do we do with this?
Exactly.
Okay.
And and obviously that was part of also of the brainstorming in terms of kind of what are we looking to do, and obviously conversations around definitely there were, I guess, themes that came out of these. Obviously, it was a long event, and it was definitely it was an entire day on a weekend that we brought everybody together, and we just had these conversations. And we had individuals from ORAU came and actually kind of led the discussion about governance and structure and all the things like that, and being able to brainstorm many other ideas. And based on the conversation that we had internally as a group, we kind of prioritized three things, obviously, around research. Obviously, one is that community engagement. How can we do community engagement, advocacy and awareness? And then the third part was delivery and trust. So these were kind of really the themes that came out of this coalition about what we're going to do, or probably think about it, the pillars that we want to build, and within our cohort and within our core, but also within a community as well. Like these are the pillars that's going to govern pretty much what we do. Community engagement is going to be essential to our success. Advocacy and awareness, it's basically going to do this to advocate and to empower, and also obviously to be able to shape and modify things based on what we do. And finally, delivery and trust is that we're going to commit to delivering those outcomes and earning trust throughout the process. And that's kind of really the pillars of what we use to build that framework.
Awesome. And now I know you're looking to do something similar.
Yes.
In Arizona, right?
Yes, exactly. Yeah. So that's exactly the continuation. I think it's kind of nice to think about this as like, now I've earned and I probably gained a lot of experience. So I think for me, it becomes a lot easier this time.
Sure.
To be able to do that. But again, I think, and as you probably relate to that, Michael, is that a community building isn't work. It takes effort, time, dedication, and really being able to put yourself out there to be able to connect with other people. But definitely having that experience already, that what I did in Idaho State, definitely allows me to feel like, I'm obviously learn from some mistakes and, gain new lessons. And so it just made me a better community builder for the next phase of my career and here in Arizona.
Sure. Well, and, you said, building community does take time. It takes a lot of effort because you have to build trust with the partners. You have to show each other that you trust and respect what everyone brings to the table. And that kind of relationship building just takes time. It's like a friendship or a marriage almost, right? It's you talked about speed dating kind of, early on, but it's really like, okay, once you've met and you've decided, okay, let's go forward. Now you have to spend time building those relationships. And so, 100%. Community building takes a while.
Absolutely.
To get there. So, but I love that, you've laid the groundwork and for a great coalition. Sounds like the same work will happen, and I expect at some point maybe likely connect as you're doing the same thing in Arizona.
Yeah. Thank you, Michael, for that. That's exactly a really nice recap, because it is true. Community-based effort and community-based research really is not for the, if it's something you want to do quickly and you just want to get it done, there's so many things you can do. But if you really are passionate about the community, it's hard work, but it's really rewarding, because like I said, it's where I felt I made a difference and I made a dent in some of these issues that we face in our healthcare system, in our society, in among populations. So I think this is the kind of work that if you're not committed to it, probably you can do something else, and there's nothing wrong with that. I think it's just the fact that if you commit to working with community, it's going to take time, it's going to take effort, and it's going to take genuine interest about working and coming along the community to do the work together. And it can be very, very demanding in terms of time, energy, and obviously being able to connect and build trust. Like you said, it's all about trust.
Absolutely.
Yeah.
One of the things that strikes me, and we talked about this before I started recording, and I mentioned a little bit, I think in the introduction, we a week ago had the Rural Health Research Innovation Cluster Workshop. And as I talked to people, and you probably experienced this building the coalition, is people doing this work feel like they're doing it by themselves, even if they're in the same community, doing the same kind of work, right? Because they're not connected. They haven't met, they haven't run in the same circles. They're in a different part of the country, as is the case with the workshop that we just had.
Yeah.
But when you find your people, when you find your family, all kinds of lights and ideas start going off. And I know the workshop that we had last week was all about, idea generation. And okay, now that we've all found each other, what can we do together? But talk about that, I guess, from the idea of you feel like you're doing so much of this alone until, right, you have that moment of like, oh my gosh, we're doing the same thing. Or we're focused on the same
issue,
priorities, same issues.
Yeah, no, absolutely, Michael, that is real. I think it is definitely, because it's very easy to feel siloed and feel like you're isolated. And especially when it comes to, you're trying to do something definitely more innovative, you're trying to focus on a specific niche and specific area. So all these things can obviously lead to that sense of isolation, and you feel like you don't have anybody to work with, or you're kind of building everything on your own, all of that. But it's absolutely amazing, and it's so refreshing and rejuvenating when you meet other colleagues who, by chance, doing the same thing, but just in a different state or in a different community or in a different population or in a different population demographics. There's so much. I mean, I think it does two things. Obviously, it validates your work. That means like, I'm glad somebody else is doing this, because that means like what my thought process is actually someone else also had. So I'm not crazy, or I'm doing something weird. No, actually, it is something very important and relevant that someone else is doing. So that definitely validates the idea, but also brings opportunities for collaboration, and especially we talk about reproducibility and obviously being able to validate. It would be obviously wonderful to see what we do in one population can actually similar or different, and why, and all of those things. So I think there's definitely opportunities while there are barriers for sure. And so just really, you kind of have to obviously collaborate to be able to feel like you're connected and you're not basically on an island on your own. At the same time, it could be a wonderful opportunity for reproducibility and being able to just to see what is unique about one population that it may be a little different than others, and if there's a common thread or themes that no matter what population, no matter what geographical location you do your research, the outcomes be similar. So it is definitely, it serves many purposes. I think emotional support is one of them too. Knowing that,
for sure.
Yeah, exactly. Knowing that you're not the only person who feels the same way. I think there are others who feel the same thing too. So just validates the fact that in science, sometimes we can get siloed, and it's just, we need to reach out. We need to connect. And I think this podcast is a wonderful way to create bridges, and people can learn about what others are doing, hopefully creating more opportunities for collaboration.
Absolutely. And yeah, for anyone who's listening, happy to connect you to Youssef. Happy to connect you to folks who were at the rural health workshop last week. Important work is happening, all over the country in places that we may not naturally assume are rural, but man, there's rural parts of the country like everywhere. Right?
Absolutely, everywhere.
10 miles outside of Phoenix, it's pretty darn.
It is so real.
Pretty darn rural, right?
Rural, yes.
So, it just strikes me as very special, the work that you're doing, the work that the folks I talked to last week are doing to really benefit everybody and make sure that everyone has equity in the system, that we all have the access that we need, whether it's to pharmaceutical drugs, to treatment, to mental health services, all of the things that are important. So I just want to say thank you for the work that you're doing.
Oh, thank you. And
I guess wanted to ask you, Youssef, for you, what's next? What happens now?
Yeah, a very good question. So I think, honestly, it was literally right before our meeting, I was really pulling up some articles that I compiled to understand the challenges and the health issues around Phoenix. So basically putting together a grant for me to start to address some of these issues around health and access and disparity within the Phoenix area and broadly in Arizona. Again, leveraging what we built, thanks again to ORU, about basically allowing me to gain that experience so I'm ready to run, to really roll in Arizona right away. But obviously, you got to be you got to be pertinent and relevant to what the health needs are in the state specifically. So you're actually complementing others and you're not necessarily kind of derailing the path. But it's definitely, for me, it's just really kind of putting together a grant around health and access in Arizona based on some published data that are really unique to the state and also a specific population within the state of Arizona. So yeah, so it's growing and leveraging existing and already ongoing resources to be able to replicate and obviously expand the work we started, the CARE Coalition, back at Idaho State.
Awesome. I love that. Well, I wish you luck on the grant application. Is there anything we haven't touched on that you want to make sure that we talk about in this conversation?
I want to really give a shout out to ORU because it really was, if it wasn't for their support, I think CARE Coalition may have not come to fruition, honestly. And I just want to thank them for that because it was, they're basically, they believed in me and they supported me. And obviously, I know it was a screening process. Obviously, it's go through that. But I think they saw something different and they saw something unique, and which honestly, I thought the same thing that really allowed me to really to be all in this project, in this coalition. So I'm really grateful for the funding. It really allowed me to be able to do something that I honestly think hasn't happened in Idaho for so long. And it was something very unique to a lot of people when I shared with them, this is the kind of work, like, wow, this is exciting and this is new. And so again, I'm really grateful to the funding. I'm really grateful to the opportunity. Again, I'm grateful for the opportunity that you highlighted my work and being able to share that with the community at large. So overall, I'm really grateful and I appreciate you, Mike, for taking the time to chat with me.
Oh my gosh, this has been the highlight of my week. And I'm not understating that at all. This has been a great conversation, and I look forward to getting this out so other people can hear about the work that you've done with the CARE Coalition and that you hope to accomplish in Arizona as well. Youssef, thank you so much for taking the time today to have this conversation. I will drop a link to your page on the university website in the show notes so that if people want to reach out to you, they can. And if there's anything else that you would like me to share, certainly feel free to send that to me, and we can get that in the show notes as well.
Yeah, great. Thank you. I love that idea. Thank you for sharing my contact information. It'd be great to connect with other colleagues. Thank you so much, Michael, for your time.
Thank you very much. Have a great day.
You too. Bye-bye.
Thank you for listening to Further Together, the ORAU podcast. To learn more about any of the topics discussed by our experts, visit www.orau.org. You can also find us on Facebook, Twitter, and LinkedIn at ORAU, and on Instagram at ORAU Together. If you like Further Together, the ORAU podcast, we would appreciate you giving us a review on your favorite podcast platform. Your reviews will help more people find the podcast.